What is it that you're doing that's not working properly and not giving you the relief that you deserve? First of all, most people, when they go to a doctor initially, they're going to get some type of medication, whether it be an anti-inflammatory, a muscle relaxant, a pain medication, or God forbid, a seizure medication like Lyrica or gabapentin, which are not approved for sciatica specifically, but are actually seizure medications because they change the chemical makeup in your brain to help calm down seizures. So why don't medications work for healing sciatica? I'm not talking about taking symptoms away, because you could take a strong enough medication and it'll calm down your symptoms, but that does absolutely nothing for healing the underlying problem. And it doesn't matter what the problem is. It could be a disc, it could be a bone, it could be a joint, it could be a muscle, it could be a tendon, it could be a ligament. Basically, sciatica is a generic name for anything that aggravates the sciatic nerve. So why medications, what I call a Band-Aid approach or a temporary relief? Let me explain. When you take a medication, you're not actually dealing with the underlying problem. You are trying to mask the symptoms. The pain medications dull the pain response in your body so that it actually feels like you're actually feeling better. The anti-inflammatory medications clears out inflammation in the area where there is inflammation. And if it's the inflammation that's causing the sciatic nerve to be pinched, you can get some relief. But that doesn't heal the underlying problem. So that's why I call it a temporary fix, because you are not getting the long-term healing effect. As a matter of fact, medications or injections of medications can actually aggravate the problem further without you even realizing it. And let me tell you how. When your symptoms are masked and decreased artificially by medication, what you're going to feel is a whole lot more normal. You're going to feel better, so you're going to be getting more active, doing things that you typically couldn't do. You're going to be actually be aggravating the problem without you realizing it, which is going to cause you to need further injections, higher dose of medication, different medications, because the medications that you're using may not be as effective if your symptoms are aggravated further because you're irritating the underlying problem. Other things that don't really help long-term: decompression or traction treatments. I know this because for the first 15 to 16 years of my practice, every back and sciatica client would be put on my traction machine. Now they have the very large, expensive decompression machines that they swear can calm down any back problem and any sciatica. But basically what you're doing, as you're lying there, you get the back pulled and then relaxed. Some are longer holds, some are shorter holds, depending on who you are, how big you are. That will all depend on the angle that gets pulled and the pressure of the pull. That's fine and dandy, and it feels great. I never had a client complain of discomfort while they were on traction. As a matter of fact, most of them felt great when I took them off traction until they had to either move and their pain came back, or standing for any length of time, more than 5 minutes. What happens is all that decompression and the pulling that you did of the spine now gets recompressed as you're standing and gravity takes its hold. A temporary relief, for the most part, yes. I've had people who say that decompression has helped them. That's a very small percentage. As a matter of fact, when I was doing traction treatments and exercises in my old treatment approach, I would help 10 to 15% of my sciatica clients. They thought I was amazing. The other 85 to 90 thought I was a quack and I didn't know what I was doing. So decompression treatments typically are not long-term and long-standing relief for you. Radiofrequency ablations, why don't they work? Well, initially, all a radiofrequency ablation is, or an RFA, is they go in and they burn the nerve endings that are painful or that are causing the pain. Artificially, you're getting rid of what is causing the pain, but nerve roots grow back. And guess what happens? In 4 to 6 months, a nerve root's going to grow back. And if you didn't take care of the underlying problem that was irritating the nerve, it's going to come right back. So many clients of mine have gone through multiple radiofrequency ablations because they love the 4 to 6 months of the typical relief that they get. The only problem is, while they are relieved of their symptoms, they go back to doing their normal activities, and guess what happens? They irritate the underlying problem even further because they're not addressing the problem. All right? So you got medications, temporary relief. You got the radiofrequency ablations. You got the decompressions, the injections. Also, people are always asking me about different creams, about different braces. You've seen, everybody has probably seen, if you talk about sciatica online, you will be getting ads for the thigh wrap, the calf wrap, the SI brace. Everybody's selling a miracle cure. And honestly, if some of those things worked more than 30% of the time for people, I would gladly put my name behind it to say, hey, you know what? Try this. It may help. But I have yet to see anything consistently. The NeuroMD little electrical stimulation unit is basically a glorified TENS unit that actually can calm the symptoms down too. Now, I tell my clients, hey, you know what? If you need the temporary relief, please, please, please get a TENS unit, because while the TENS unit is on, it's actually blocking the pain response, so you actually feel better. But in the same way as a medication, you're masking the pain, so you have to be wise with what you do right when you are on the TENS unit, because the TENS unit, typically when you turn it off, your symptoms just gradually come back because you're not blocking the pain response. All right. So you got the medications, you got the TENS units, you got the injections, the radiofrequency ablations. And then the big thing that everybody does is they go online, or they go to a chiropractor, or they go to a PT to get exercises to help them overcome their sciatica and stretch out the pain. All right. So let me ask you a common sense question. You've got some butt muscles or hamstring or calf muscle that are just tight and achy and sore. Why do we think that taking that tight muscle, and instead of getting it to relax, we go, hey, in order to get it to relax, we got to make it tighter? I always tell people that is a similar thinking to this. Number one, if you had a scab on your arm and you kept scratching it, even though it itched, oh, it feels good when you scratch it. But what happens when you look down 10 minutes later? The scab is now ripped open and the healing process has to start again. Or more directly, if this side of my head was sore, and I went to a doctor and said, doc, right here, it's really sore and killing me. And he said, Dean, here's what you do. You take the palm of your hand, you hit the side of your head 25 times, 5 times a day, come back to me in 2 weeks and tell me how you feel. Most people would look and say, that is crazy. So my question is, why, when we have a tight, irritated muscle, are we either digging on it, or have you dig on it, roll on a foam roller, and have you stretch it and exercise it when it's already irritated and mad and tight? That just doesn't make sense to me. And let me tell you, I've had so many clients who tried every exercise, and it's because when you're doing wrong exercises for your condition, you are just going to aggravate things further and actually prolong the time it takes for you to heal. I mentioned Christine before. She was doing every stretch in the book. She knew almost every stretch that is on Google and from doctors. And when we talked the first time, I said, okay, I may be doing similar type things to what you're doing, but I'm not going to be doing it to your painful side. We're going to work on the opposite side. We're going to try and find where in your body you can move without pain, you can stretch without pain, and see what happens. And guess what? Within 8 weeks, Christine was living again. She was able to hold down a job. She was actually told she couldn't have a baby. And now she has, I believe the son is 2 or 3 years old. I also think of Eve Goffings from Belgium. She was bedbound for 10 years from piriformis syndrome and sciatica. The last 5 years of those, she was actually couch-bound. She couldn't hold a job because she couldn't sit, she couldn't stand, she couldn't walk and be active enough to be able to hold a job. She was barely able to go shopping for herself. But guess what? We got her into my program, and within 8 weeks, she was driving long distance. She was living again. She held down a job even after the doctor said, you'll probably never be able to hold down a job again because of the damage in your piriformis muscle and the way it was aggravating your sciatica. So I have many other similar stories of people who went to PT, who are doing all the gurus. Hey, here's the 3 best exercises for sciatica. Hey, you want to get rid of your sciatica in 20 minutes? Do this exercise routine every day. Guys, there's no quick fix, but there is a simple, easy fix if you follow some steps. So here it is. Here is the simple approach that actually works, that I changed in my practice about 15, 16 years ago, and my success rate for my sciatica clients went from the 10 to 15% immediately up to 75 to 80%. And now that I've been perfecting it and changing and tweaking things to help more people, we're about a 95 to 98% success rate, depending on the underlying conditions that are causing the sciatica, but we're still over 95% with our clients. And here's the first thing that you need to do. Number one, you need to be able to identify imbalances in your body, okay? And through my programs, that's what we teach. We show you how to move, how to assess yourself, because you know what? I don't want you dependent on me for the rest of your life to get you out of pain. I want to be able to help you, empower you, and instruct you and teach you how to find your imbalances and fix them so that you can have long-lasting, sustainable relief. All right? So that's number one. Then 3 quick things that you can do that anybody can do right now to help them start on their sciatica relief journey. Number one, you've got to recognize what are the triggers. And a trigger is anything that amps up your pain, any activity, movement, or position that aggravates your pain. So you need to find those triggers and, as best you can, either eliminate those triggers or find a different way to do those activities, movements, and positions so you don't keep triggering your pain. Because there's no reason you need to keep doing this to yourself while you're hurting, okay? We want to be able to do this and stop you aggravating your pain. So find your imbalances, learn your triggers, and then 2 simple things. Drink more water. It has been found that about 70% of people walk around in a state of slight dehydration to a full-fledged dehydration. And what that does, it does not allow your body to function normally. The cells in your body need the water. Your brain needs water. I believe it's 60 to 70% water. You need enough water. You need enough liquid in your body to keep your cells actively being able to decrease the inflammation in your body and delivering fresh oxygen to areas that need it for healing. Drink more water, get good sleep, learn your triggers, and find your imbalances. And that's what we teach. That's my big mantra with people. You have to find your imbalances, because if you don't know what's out of balance, you are not going to know what exercises, what movements, what positions you have to do to get out of pain. Now, the reason that most of these generic exercises that you've been trying on Google, that you've been trying from YouTube, that you've been trying from your PT, chiropractor, doctor, osteopath, personal trainer, Pilates instructor, yoga instructor, the reason they don't work is because what happens when your body has pain is your body naturally compensates for itself. And so when your body is naturally compensating for pain, it throws your body out of balance, right side versus left side, because if your right side is where your pain is, your body's going to shift to the left. All the different muscles in your body are going to have to compensate to try to get all the weight away from that right side so we minimize the pain while we continue to function. So if your body is out of balance and you're trying to do yoga and yoga instructs you to work both sides evenly, or if you're working that painful side thinking, I can just push it to get it here, you're causing your body more pain, which causes more compensations, which causes more imbalances. So that's why working both sides of your body doesn't work. And that's why working the painful side of your body doesn't work. Okay? So here it is, the 3-step simple solution to get your body back to a position where it can heal and where you can start living free from sciatica. Number 1, we already talked about it, but you've got to know where your imbalances are, because step 1 is we've got to balance out your body's imbalances. Because if these imbalances are like this and we take this away, guess what happens to the tension and the stress in your body? It automatically relaxes and calms down, which means the muscles that are protecting the area of the problem are not having to battle all the tension and all that extra muscular stress, so that the body can relax. And as the area around the irritated area starts to relax, you get normal blood flow, normal nerve conduction, and healing starts to take place. Now everybody's talking about, hey, you got to get your core strong. Just strengthen up that core and you will be fine. That is true once your body's balanced. But if your body's out of balance and you go and try to stabilize things, which is step 2 of my 3-step process. So first we balance out imbalances, and then we stabilize you in that balanced position. Because if we start stability exercises or strengthening exercises while your body is out of balance, we're only reinforcing those imbalances and holding your body in an abnormal position and condition, and you're not going to be able to get the body to relax as easily so that you can promote healing. So step 1, balance out the imbalances. Step 2, stabilize your body in that balanced position. We got to get your glutes kicking in, your abs kicking in, and we teach you that in my programs. And finally, step 3, once we balance and get you stabilized, then we return you to normal activities slowly and wisely. And the reason we do it slowly and wisely is because just like a muscle sprain or an ankle sprain, if you sprain your right ankle and you roll it over, it's going to take 6 to 8 weeks to start to calm down and actually get healed before you can start getting active on it again without doing more damage. But you need to slowly and steadily get back into doing things, because if you go out and just start running without having that ankle strong and stable, you are more likely to aggravate it again. Think of this. If someone had shoulder surgery, are they going to take their arm and just start moving it right away? Or are they going to allow the tissues that were surgically repaired to heal? So I always tell people, think of your sciatica as a wound. You're not going to take that wound and stretch it and pull it and yank it and crank it. First, you've got to get it to heal and calm, and then you gently and steadily get back into your normal routine. And the reason we go slowly and steadily and not all at once is because if you happen to flare up that sciatica again, we want to know what movement, what position, what activity, what did you do that flared it up? And say you're someone who likes to work out and we get you feeling better. And we've had this happen before. Somebody goes back to the gym, they ride the bike, they start doing shoulders and butt muscles the first day. So they do 15 to 20 different exercises with different weights and different resistance, and they feel great. And the next morning they wake up with their sciatica back. We have no idea which exercise, what weight was the causing factor, what movement was the causing factor. So I always encourage my clients, let's get you back slowly and steadily. Do 1, maximum 2 exercises the first time you go back to the gym. If over the next 2 to 3 days, no aggravation, either increase both of those things or add something in, and we slowly get you back to doing what you're wanting to do and what you love to do. But we do it in a way so that we don't flare things up. But if we do flare things up, we're able to pinpoint, okay, that's the activity. We need to either hold off on that or slowly get back into it and do it at half speed compared to what we were doing. I hope all that makes sense. By the way, as a PT, I, for the first 15 years, was going about fixing sciatica the wrong way. And I see many PTs, chiropractors, therapists, and doctors doing the same things that I used to do that made my client's sciatica worse. I actually made a video about how the first 16 years I was doing things wrong, and you can actually check it out on the next screen right now.